Welcome to Baby's Birthday. Each show joins a mum-to-be and counts down to the birth of their baby, revealing all the drama, laughter and tears involved in giving birth. Because let's be honest, giving birth is never a walk in the park. To help chart each birth, this is the Baby's Birthday Clock. It's there to count down to each mum's due date. And once labour kicks off, the clock kicks in and times the birth so you know exactly how long each mum's been in labour, whether it's 2 hours or a whopping 20 hours. All the action of the birth is boiled down into a half-hour show. So, we'd better crack on.
Is there any noise?
Coming up on today's show, Stephanie and Peter are both expecting their third child together, and Steph is having an elective cesarean.
I can't really relax till I know they're both okay.
Stephanie and Peter already have 2 children, Charlotte, who is 6, and 5-year-old Athens. They met through Steph's work.
I've been with Peter, my husband, for 8 years. We've been married for 2 years.
When I first met Stephanie, she worked at a taxi firm, and I was talking to her on the phone because I used to get a taxi home quite regular, and it sort of blossomed from there.
So their blossoming love has now produced baby number 3, and it looks like it's another girl.
Steph really wanted a third child. I was more, it happens, I wasn't really that bothered. But I'm getting more excited now it's getting closer because, like with the other 2 children, you never know what's going to happen from one day to the next. They're a lot of fun.
You're going to make yourself sick?
Faster?
Yeah. We did plan this pregnancy. We were trying for 16 months. Well, about a year because I was 4 months pregnant when I found out. We did have some problems. I was diagnosed with polycystic ovaries and I was told I'd need to take a drug called metformin to regulate my cycles and that would, help us conceive. And all the symptoms of the drugs are pregnancy symptoms, you're nauseous and tender breasts and just everything, that's related to pregnancy. But because my periods were irregular anyway, I didn't think anything of it until a few months later. I'd had a pregnancy test at the dining table for about 3 weeks and I thought, I'm going to do it, and eventually did. And it wasn't until I booked my appointment with my midwife that she said, you're 17 weeks pregnant, so quite a while.
That's it, it's just we won't be able to get you off now.
But when Steph told the family the news of the pregnancy, there was mixed reactions.
When I first heard the news that Stephanie was pregnant, she was quite far gone, so a mixture of relief and just quite happy. More happy for Steph than for myself, and the kids were more excited than anyone, I think.
It's the day before the elective cesarean, so while Stephanie packs her bag, Nana is around to help with the kids and give them all a lift to hospital.
Are you excited? No, you're not. I was like that when my mum was having one of mine.
I'm having a planned cesarean because I had cesarean with my 2 other children. So I've just been told all along that I'm automatically having a third cesarean section.
The last 2, she actually went into labour, and then when she'd been in labour a while, the babies were distressed, so she had to have the emergency section.
So Steph has never had an easy time with labour.
When I had Charlotte, my eldest daughter, I had to be induced because I had preeclampsia. I don't know if it's because my body wasn't handling the labour very well. I wasn't dilating, and every time I had a contraction, the baby's heart rate dropped, so the baby went into distress. And then the same thing happened the second time with Athens, and because they could see the same things happening, they took me for the cesarean a lot quicker than they did the first time.
After 2 emergency cesareans, everybody thought the best option would be a planned C-section for the third.
When you have 2 cesareans, I think it's because they don't know if your body will be able to handle the pushing, and your scar tissue isn't very strong because you had 2 operations before. So I don't think they need to chance. I think they just like to do the cesarean, to not risk any problems.
With their past births being so problematic, the thought of more kids must be daunting.
We don't plan on having any more children after the third. for the simple reason that we've been told like 3 cesareans should be the maximum that you have. Hey. But knowing Stephanie, she changes her mind all the time, so we'll just see what happens.
Most cesareans are done with an epidural, but Steph has unusually requested a general anaesthetic.
I asked for a general anaesthetic just because of the worries of being awake. With the local anaesthetic, if it's the epidural or the spinal, I didn't like the thought of something going in my spine. Well, when I had my other 2 children, they were both emergency and they were done under general anaesthetic, and I'm quite concerned about being awake. I don't want to feel the tugging or know what's happening or know they're sewing me up or anything. I just want to go to sleep, wake up and have the baby there, which is nice really. I don't have to do any hard work.
The midwife comes in to make sure Steph's feeling okay, but her nerves are beginning to show.
I'm really nervous because I've never gone into hospital like this before. It's always been, you know, for an induction. I've never been, you know, knowing that I'm going to have surgery the next day. It's quite worrying. I know what happens once I've had the anaesthetic and I wake up and the baby's there, but I don't know what happens beforehand.
You're first on the list, and it's about between 9 and 9:30 we start.
Right.
Okay.
What time does your husband come?
You can come in for 9 before she goes down, if that's all right with you.
Yeah, it's cool. Yeah.
But if there's an emergency in and it's there before you, so there can be a delay because of that.
Okay.
Just to warn you, so hopefully you will be down about 9ish. But if there's an emergency at 8 o'clock, it'll take priority.
Do I walk down there or do they push me in a wheelchair?
It's totally up to you, you tend to walk down.
Right. Do I get changed before I go or?
Yeah, we get you in a theatre gown. You have the choice to be catheterised up here or in theatre once you're put to sleep. It's totally up to you.
Okay.
You've been a couple of times with the baby not moving properly, so I'm going to monitor you. We routinely don't for sections, but because you've been in twice with DFM, it's a routine thing we do. Is that okay? Is that all right? The other thing is you've had raised blood pressure in the past, haven't you, with the others, and an episode with this time as well. So we thought we'd just do your bloods as well for that, just to make sure everything's okay. Is that all right with you?
That's fine.
It's just over 12 hours to the operation, so while the midwife carries out the checks on mum and baby, Charlotte decides to join in too.
Is there any noise?
Well, it's
I can hear you talking. Can you hear that? Let me listen in you. Which side's it on? I can hear it, you know. Yeah. Go and do it on Athens because it goes like that on Athens. You hear it, Charlotte?
No.
Well, you don't need to push it right back in the chair with it. So don't you reckon it'll be big?
I was going to ask my midwife, you know, to give me a guess of how much it was going to weigh and never got around to it. They can normally guesstimate and we should have done that at the church fair. How much will the baby weigh? 10p a go?
So with all the checks over and done with, it's time for the family to go home and leave Steph to get a good night's rest before the big day.
You're going to get a kiss off mummy? Yeah, they're fine. You're getting a kiss off mummy? Love, come.
Tomorrow can we come here and see the baby?
Of course you can.
See you tomorrow, Athens. Bye-bye.
You're not going.
Yeah,
Come on, sweetheart. Oh, it's a mess.
Oh, wait a minute, let me start playing a bit. What?
I'll see you tomorrow.
Mm-hmm.
I'll see you tomorrow.
I know.
When Peter and the children left, it dawned on me that this is really happening. There's no going back. It's happening tomorrow. I've not got any extra time. It's definitely here. It made me think more about what was going to happen, which I'd been trying to put off, and that was the only thing I could think about was the surgery the next day. And having a baby as well, but the surgery was quite scary, the thought of having surgery.
Coming up after the break, Steph goes under the knife while Peter waits anxiously for news.
I'm just more concerned they'll both be fine. I'll be okay from now.
Welcome back. Married couple Stephanie and Peter are expecting their third child. After having 2 emergency cesareans with both her daughters, Steph has elected to have a C-section with a general anaesthetic this time.
Did you bring one down?
No, she hasn't brought one down.
I'll get one
Do you want me to go and get one?
So while Steph hops up onto the operating table, Peter is along the corridor in the waiting room.
I arrived at about 9 o'clock at the ward upstairs, saw Stephanie, and then she's just gone into the theatre room now. I'm just going to...
That's it. That's it, take your time. Take your slippers off, okay.
When I went into theatre, they said come and, climb up onto the bed, and it was surreal because even though they explained everything that was happening, it was just, like it wasn't happening to me.
When I went to see her this morning, she seemed okay. She's just a bit more nervous than last time because she's had time to know when it's exactly going to be, when she's going to go into the theatre. So I think she's just a bit nervous. But she seems okay.
This one as well. They're taking your blood pressure for you today. Already. Any problems? No.
Because I hadn't been through it before, where I was aware of it, it was nice to know what they were doing when they said, this is to make you feel drowsy, and then this liquid is going to make your eyes feel heavy, you'll feel a slight pressure here, this is to do this. It was nice to know everything that was happening.
While Stephanie is being kept well informed, Peter is on his own, not knowing what is going on.
I'm just more concerned that they'll both be fine and I'll be okay from there. At the moment, I can't really relax till I know they're both okay, and then we can see what happens from there.
They gave me a fluid to drink, which tasted absolutely disgusting, and I think it was something to do with the stomach acid.
The liquid Steph drinks is sodium citrate, which helps settle her stomach during the op. Meanwhile, to help pass the time, Peter contemplates baby names.
So we're going to call her Lily May, but we don't know about a middle name yet. We're undecisive. If it's up to Athens, it'll be Butterfly, but I don't think there's much chance of that. They've already come in the bedroom this morning, waking me up to tell me we're having the baby born today. So when they finish school, I'll bring them up here later to see.
When the anaesthetist came, he tried to keep me calm when they were putting the drip in my hand, trying to take my mind off it, and they were so nice. I felt a bit closed in as well because there was that many people around me. They explained everything that they were doing. They said putting like a machine thing onto my legs to, help. I think it's help for circulation when you're under.
Steph has floatrons strapped to her legs, which will help her circulation during the operation and prevent blood clots forming.
Just still nervous. I won't be happy really until, like I say, they're both okay.
Stephanie is fine, but the anaesthetic has taken effect, so midwife Marie takes us through the procedure.
The procedure for a caesarean usually is getting the lady into theatre. In this case, she had a general anaesthetic, so the anaesthetist gives the general anaesthetic, get the lady to sleep, and then get the baby out as soon as we can, really, to reduce the risk of the baby getting any of the anaesthetic. Normally, ladies have a spinal anaesthetic these days, but Stephanie had requested that she have a general anaesthetic because that's what she'd known before. It's unusual for ladies to have a general anaesthetic because they request a spinal so that they're awake when the babies are actually born. And ladies like to meet the babies immediately these days, and they're more in control, they know exactly what's happening. Whereas with the general anaesthetic, they're fast asleep and don't know anything that's going on.
With the anaesthetist's job done, it is now time for the consultant to take over. Steph is covered over with a sterile abdominal cover, which sticks to her body and leaves an area of sterile skin for the doctors to work with, helping to avoid infection. Look away now if you're a bit squeamish. After going through several layers of skin and tissue, the doctor reaches a layer of muscle, which they make a small incision in and divide it with their hands. It looks painful, but Steph can't feel a thing. A couple of layers down and the doctor is finally at the womb, where she has to be careful when making the 6 to 10 centimetre incision as the baby is waiting just beneath it. The consultant cuts through the amniotic sac, breaking Steph's waters. The baby is born head first, as it would be with natural birth when everything goes to plan. And in a total of 3 minutes from Steph going under, baby Lily May is born. It's okay. You can look back again. The horrible bit is over.
My role was to take the baby, dry the baby, get it wrapped up, make sure everything was okay. We rub the babies to stimulate the baby to breathe on its own and to dry it as well, so it doesn't get cold. I used a little oxygen mask because baby was a little bit sleepy when it was born, so just to stimulate the baby and make it wake up. We check baby's length, the head circumference to see how big the baby's head is, check in the mouth, check that baby's got all its fingers and toes. Then turn it over and check that baby's got its spine's okay and that all the skin's intact, and just a general check.
So after Lily May is checked out, she's finally weighed.
Eight, 9.
On the other side of the room, the consultant is still busy at work. While Lily May is finally wrapped up to go and see her dad, Steph is being stitched back up.
3, 4, 5 on the board. I took the baby to her dad because obviously mum was asleep and couldn't have a cuddle, and dad would be excited to see the baby because he wasn't actually in theatre when she was born. Here's your daughter.
Bit of a porker, isn't it?
She is, £8 now.
Alright.
Have a look at her after. How's she feeding her?
Breastfeeding.
She's sure.
Yeah. Can I pick her up or?
Of course you can.
Yeah.
It's yours.
Thanks. I forget how little they are.
You manage. What's capacity? You got her.
That's right, thanks. Oh dear. When the baby was brought out to me, I was just relieved that the baby was okay, and the midwife told me that Steph was okay. So it's good. It was a good feeling.
While Peter gets acquainted with his new daughter, Steph is being brought around.
Stephanie? Stephanie, open your eyes.
Alright, Stephanie, your operation's all done. Take some nice deep breaths.
When I was coming round, the only thing I remember is how much it hurt. because at that time you haven't had any painkillers, you're just coming around from surgery, and it took quite a few minutes before they set up the morphine for pain relief, and it wasn't nice at all.
Generally after a caesarean, if the lady's had a spinal, that'll be effective for a few hours after the section. But when the lady's had a general anaesthetic, there's no pain relief. So Stephanie had a PCA pump, patient-controlled analgesia, where she's in control of the morphine and the amount that she's getting. So each time she's got some pain, she can press the button and get some pain relief.
So it's time for Steph to leave theatre, be reunited with Peter, and finally meet Lily May.
Yeah, you're right there, Doc. Neil, we ordered some on your list, some doctors' toilet rolls.
I was still very sleepy when they first gave the baby to me. I couldn't really focus on her at first. I remember them telling me how much she weighed and was very surprised because she was very heavy.
Don't try and lift her up for me, let me hold her for you.
And I fed her pretty much straight away, which was really nice.
Get out! Get out there!
So after 4 days in hospital, Lily May is finally home with the rest of the family. And her two sisters, Charlotte and Athens, love her very much.
Is she a good baby or is she a loud baby?
Hello, baby.
And
She moves a lot.
she wriggles about.
And she wants feeding a lot.
She was feeding all the time, doesn't she?
That's why she.
Daddy has to keep putting
She
her to bed.
she got some teeth when she was born.
She has. White face, hasn't she?
After a year of trying and 9 months of pregnancy, Lily May was born after only a 3-minute caesarean operation.
After all the time we spent trying, I'm just happy to have my little girl. I'm happy I've got my 3 girls.